If you're over 60 and your knees, hips, or hands hurts most days, you are not alone. Joint pain is one of the top reasons older adults slow down, skip walks, or stop hobbies. Pills can help, but they can also strain your stomach, kidneys, and heart when used often. What if a simple juice habit could calm pain fast, support healing, and help you move with confidence again? Stay with me, because in this countdown you'll learn 7 smart juice moves, why they work in your body, and exactly how to try them tonight. This video is educational and not medical advice. Always talk with your healthcare provider. After 60, your joints change. Cartilage, the smooth cushion on the ends of bones, thins out. The body makes less synovial fluid, the slick liquid that lets joints glide. Muscles shrink faster and tendons stiffen, so the joint has less support. Pain is not only uncomfortable, it slows your steps, steals balance, and raises fall risk. Inflammation also lingers longer with age because the immune system is less efficient at turning off the alarm. That means a twist from gardening or a long grocery trip can flare pain for days. The right fluids can help. Certain juices carry anti-inflammatory plant compounds, gentle enzymes, and hydration that feeds joint fluid. When you combine those with steady movement and safer habits, you protect your independence. I'm your guide to healthy aging, and this channel is for adults 60 plus and the caregivers who love them. If you want strong joints, sharp thinking, and daily energy, tap like and subscribe. Tell me your country in the comments so I can tailor tips to your foods and stores. Let's count down 7 juice habits, from helpful to most powerful, so you can pick one to start tonight. Habit number 7. Ignoring hydration before meals. Here's a simple truth. Many older adults feel less thirsty, even when the body needs water. When you start meals already low on fluid, your joint lubricant thickens and movement feels creaky. Your brain and muscles feel it too. According to the National Institutes of Health in 2020, hydration supports cartilage and synovial fluid, which are mostly water, and even mild dehydration can worsen stiffness and cramps. Think of synovial fluid like oil in a hinge. Too little, and every step grinds. Short term, you feel tight when you stand up. Long term, you move less, lose leg strength, and raise your fall risk. Do this tonight. Drink a glass of water 20 minutes before each meal. Add a squeeze of lemon if plain water bores you. Keep a glass by the kettle and sip while you make breakfast. Aim for pale yellow urine by midday. If you take water pills, ask your clinician how to balance fluid safely. Up next is a red juice with plant power that many people feel within days. Habit number 6. Skipping tart cherry juice. You may think cherry juice is just a sweet treat. Tart cherry is different. It is rich in anthocyanins, plant pigments that calm inflammatory pathways that fire inside sore joints. Research in the journal Osteoarthritis and Cartilage in 2013 found that adults drinking tart cherry juice twice daily for several weeks reported less knee pain and better function. The likely mechanism is reduced oxidative stress and lower inflammatory signaling, which lets irritated tissues settle down. Why it matters more after 60. Your recovery window is slower. When inflammation lingers, it nudges you to avoid movement, and then stiffness and weakness spiral. Start small to see how you respond. Pour half a cup of 100% tart cherry juice in the evening. Try another half cup in the morning on active days. Keep total calories in mind if you watch blood sugar. If you take blood thinners or have kidney issues, check in with your doctor first. Many people notice easier mornings within a week. Next comes a green blend that feeds your joints and your bones at the same time. Habit number 5. Avoiding green juice blends. Green juice can look trendy, but for aging joints, it is practical fuel. Kale, spinach, celery, and cucumber carry magnesium, potassium, and vitamin K. These nutrients support muscle relaxation, bone strength, and calm inflammation. According to research highlighted in the Journal of Nutrition and Aging in 2018, higher magnesium intake is linked with better cartilage status and fewer aches. Vitamin K helps guide calcium into bone, which keeps joint mechanics aligned. For older adults, that alignment matters. When bones thin and muscles weaken, the joint bears stress in the wrong spots and pain follows. Try a simple blend. Combine a handful of spinach, half a cucumber, a stalk of celery, and a small apple with water. Blend if you prefer fiber, or juice if chewing is hard. Both can help. Add a spoon of ground flaxseed for plant omega-3 South. Start with a small glass with breakfast and see how your stomach feels. If you take warfarin, keep vitamin K intake steady and discuss changes with your clinician. Coming up is a tropical juice with a natural enzyme that can take down swelling. Habit number 4. Forgetting pineapple's bromelain morning stiffness after yard work or a long car ride is common. Pineapple contains bromelain, an enzyme that helps break down proteins that drive swelling around irritated tissue. Clinical Rheumatology reported in 2016 that bromelain supplements reduced osteoarthritis pain and stiffness for some patients, with fewer stomach side effects than frequent anti-inflammatory pills. Pineapple juice offers a food-based source of bromelain plus hydration. Age makes this more useful because healing signals can stall. When fluid pools overnight, knees and fingers puff and feel tight. Try 4 to 6 ounces of unsweetened pineapple juice with a protein-rich snack to steady blood sugar. Add a pinch of turmeric and a twist of black pepper to your day for an extra anti-inflammatory nudge. If citrus bothers your reflux, sip slowly and choose earlier in the day. Track how your joints feel for 1 week. If swelling keeps returning, ask your clinician about targeted therapy. Next, we'll tap a ruby red juice that supports cartilage and even brain blood flow. Habit number 3. Not using pomegranate polyphenols. Pomegranate juice is loaded with polyphenols that act like shields against oxidative stress in cartilage. Less oxidative stress means fewer signals that break down the collagen matrix inside your joints. Nutrition research in 2014 reported improved markers of oxidative balance and better joint comfort in adults with arthritis who added pomegranate juice. You may also get a bonus. Studies suggest improved blood flow to the brain, which supports attention during exercise sessions. Why older adults benefit most. With age, the cleanup systems that clear free radicals slow down. That leaves joints vulnerable after minor sprains or overuse. Pour a small glass of pure pomegranate juice after dinner or after a walk. Mix it half and half with sparkling water if you prefer a lighter drink. Keep it in a dark bottle in the fridge to protect those sensitive compounds. If you manage diabetes, count these carbs in your plan and pair with protein. Up next is the habit that quietly adds pain and pushes many seniors toward the emergency room for blood sugar swings. Habit number 2. Leaning on sugary juice drinks labels can fool anyone. Juice cocktails and large glasses of sweet orange juice spike blood sugar and fan the flames of inflammation. For joints, that means stiffer mornings and sore afternoons. The Centers for Disease Control and Prevention has reported across multiple years that many adults 65 and older live with diabetes or prediabetes, conditions that increase inflammation and joint problems. Quick sugar highs can also set you up for lows that cause shaky legs and falls. Swap the pattern tonight. If you enjoy orange juice, pour a small 4-ounce glass and savor it with a protein breakfast like eggs or Greek yogurt. Choose 100% juice without added sugar. Better yet, eat the whole orange for fiber that slows the sugar rush. Flavor water with orange slices or mint to enjoy citrus taste all day. If you track glucose, watch how different portions move your numbers and adjust with your clinician's guidance. Our final habit is the most powerful because it blends quick relief with safety, and it can prevent dangerous medication mix-ups. Habit number 1. Skipping a safe, Targeted morning tonic and medication check. Here is the move many viewers say helps fast. A small morning tonic that pairs ginger and lemon with a splash of tart cherry can reduce that first step sting. Ginger contains compounds called gingerols that quiet inflammatory enzymes. Phytotherapy research in 2015 reviewed trials showing ginger can reduce arthritis pain for some people with fewer stomach issues than routine non-steroidal drugs. Lemon in warm water hydrates and may support digestion, while the tart cherry adds anthocyanins for extra calm. Now the safety piece that matters most after 60. Many older adults take multiple medicines. Grapefruit juice and some other juices can change how certain drugs are processed in your liver. The U.S. Food and Drug Administration has warned for years, including updates in 2022, that grapefruit juice can raise levels of several heart and cholesterol medicines. The Canadian Medical Association Journal described real-world harms from these interactions in earlier reports. That is why this habit is number 1. Mix help with caution. Try this tomorrow. Warm a mug of water. Squeeze half a lemon. Grate a thumb of fresh ginger, steep 5 minutes, and add 2 tablespoons of 100% tart cherry juice when it cools a bit. Sip before your first steps. Then call your pharmacist or doctor to review your medication list and ask which juices are safe for you. If pain stays high, request an arthritis check, a fall risk screen, and a review of over-the-counter pills you use. A personalized plan plus smart juice habits protects your joints and your independence. You learned how pre-meal water thins joint fluid and eases stiffness. You saw how tart cherry brings anthocyanins that calm pain. You discovered green blends that feed muscles and bones together. You met pineapple's bromelain to take down swelling after busy days. You added pomegranate's polyphenols to shield cartilage and support brain blood flow. You trimmed sugary juice drinks that spike inflammation and sap balance. You built a safe ginger lemon tart cherry tonic and paired it with a medication review to avoid dangerous interactions. Which one surprised you most? Tell me in the comments and share your country so I can tailor recipes to your stores. If this helped, tap like and subscribe for weekly tips that keep you strong, steady, and independent.